Hi, good morning. I am Solomon Atuman from FHI 360. Today I will share our experience in Northeast Nigeria, where we engage a critical but often overlooked group in IYCF. These groups are the fathers. Um, this is the story of how we shifted power, challenged norms, and empowered over 120,000 men to become champions for nutrition in their own communities. I'm sure you have the question, why involve fathers in IYCF? In the Bay States, which is severely affected by conflict and displacement, malnutrition rates remains very high. IYCF indices are low and poor. But in our programming, we realize something very important as well as powerful. This is the fact that while mothers were the focus of most IYCF interventions, fathers were the decision makers in the home and the community. The fathers were controlling food purchases, they were the ones controlling care seeking as well as family support. Yet, they were absent from almost all nutrition and IYCF activities. In a humanitarian settings like ours, where roles are shifting and a lot of changes are happening in the home front, this gap represented both a challenge as well as an opportunity for us. So, what did we do? We asked ourselves, what if we intentionally brought fathers into the IYCF space? We felt this was going to yield a more holistic and uh, uniform approach to our IYCF messaging and adoption. So we went about forming father to father support group in Damasak, Banki, Bama, as well as Ngala. LGS in this in these are the areas where we primarily implement our activities. Through this initiative, we were able to train male facilitators who lead sessions on feeding and shared caregiving in the Majalisa. Majalisa is where men naturally meet in these settings. They meet either in the evenings or in the mornings where they are not going to farms to have their normal discussion. So we also use radio dramas, jingles, community theaters to spread messages in local languages. We also organize, joint IYCF counseling sessions for couple to ensure that we deliver messaging uniformly and empower them with knowledge and skill that they will be able to be on the same page in the home front. We also worked hand in hand with religious and traditional leaders to make sure that we shift norms at the community level. This involves the bulamas, talking to the tradition, the imams, the line leaders, and other key stakeholders in the community. This wasn't just about including men; it was about transforming how they saw their role in child nutrition. After this intervention, what changed? The results were clear as well as measurable. We were able to reach 128,000 men across these three local governments of Ngala, Mobar, as well as Bama local government. Here's what we saw improved. Some of the indices we were able to measure were early initiation, which improved from 59 to 94%. We also had exclusive breastfeeding for infants under 6 months, increasing from 57 to 96%. Um, Minimum dietary diversity for children 6 to 23 months rose from 21 to 41%. And we also saw an improvement in joint decision making on feeding and healthcare, increasing from 46 to 71%. Fathers promoting, timely care seeking for sick children rose from 38 to 64%. Now, beyond these numbers, I we saw stories of change in the community. I quote a father who said, "I now remind my wife to breastfeed. Before, I didn't know this was my role too." That was a father in one of the locations where we are implementing. The quote speaks volume, not just about knowledge gain, but about roles that have been redefined. What did we learn now? In terms of lessons learned, the first thing we learned was that male involvement is possible, even in fragile contexts. Truth is that fathers want to help, They just need the right tools, and they need to be pointed to the right directions, and they will be more helpful in the home front. Secondly, we believe that we learned that behavior change is achievable. We saw fathers not only learning but also advocating publicly for good IYCF practices. And then the next thing is that gender transformative design matters a lot. Um, in these regards, we know that you must go beyond the awareness to address power dynamics, shared responsibility, as well as cultural expectations in the homes as well as in the communities. We also learned the value of community gatekeepers. So, in engaging the imams, the elders, the bulamas, and the leaders, it was vital. This was vital to creating space for this shift to take roots. So I will leave you with this. Fathers are not barriers, they are enablers. With the right approach, they become advocates for their children's health. Let's stop excluding them from the conversation. Thank you very much for listening. I'll be happy to share more tools, resources, or data. And you can also reach me through my email, which is displayed on the slide. Thank you and have a nice